In this video, we will be discussing the ideal timeline of prosthesis attainment. Research has found that patients who are fitted and trained in the use of a prosthesis between 4 to 6 weeks after surgery were found to have better rehabilitative outcomes when compared to those who received delayed fitting and training. As such, this graph represents the ideal time frame for a person who has a new upper limb amputation. This timeline provides an overview of both prosthetic and occupational therapy intervention. If a patient has an old amputation and didn't meet with a prosthetist or receive any post-operative OT, this graph can be adapted as a general timeline for when they do begin their prosthesis and OT journey. More detailed timelines for pre-prosthetic and prosthetic training with an occupational therapist will be discussed in another video. Barriers to access can play a large role in a patient's ability to get a prosthesis within the ideal timeframe. These factors also largely impact whether or not a patient receives therapy after undergoing an amputation. Unfortunately, for most individuals, this timeline is not the norm. Because of this, it's increasingly important for patients and practitioners alike to receive optimal education and in turn increase access to care and improve rehabilitative outcomes. So what does the process of getting a prosthesis look like? Step 1 of this journey begins with the consultation with the prosthetist. The consultation gives the prosthetist the opportunity to hear the patient's story and obtain any background information that is prevalent in gaining a prosthesis. At this point, the prosthetist will also discuss with the patient their insurance and coverage and what the next steps are moving forward. If the patient is someone who has recently undergone an upper limb amputation, the consultation with the prosthetist will ideally take place during the 0 to 2 week mark. During this time, the prosthetist will obtain any information and fit the patient with a preparatory device like an AmpuShield or a koala. These devices can help protect the residual limb, promote healing, improve balance, and help prepare the patient for receiving a prosthesis. Step 2 involves having a formal evaluation with the prosthetist. During the evaluation, the prosthetist will review the various options available based on the patient's level of amputation and discuss what the plan is moving forward. Step 3 is casting. During the casting phase, the prosthetist will take measurements of the residual limb and use those to create a mold of the residual limb to make a test socket for the final prosthesis. Here are a few pictures to demonstrate what the measuring and casting process looks like. First, the prosthetist will take measurements of the residual limb and then use a variety of casting materials to create a mold. Step 4 is fitting. The mold of the patient's residual limb that was created during the casting phase will be used to create what is called the test socket. The fit of the test socket will be examined during the fitting stage. During this time, the prosthetist will ensure that the test socket is comfortable for the patient and that the patient has maximum mobility. Here is what the test socket looks like. It's typically clear so that the prosthetist can see how it conforms to the various grooves, soft tissue, and bony prominences of a patient's residual limb. All of this is evaluated during the fitting stage. Here are a couple more examples of test sockets. Step 5 is alignment. During the alignment phase, the prosthetist will align the length of the prosthetic limb with the patient's intact limb if they have unilateral limb loss. If a patient has bilateral upper limb loss, they will use a variety of measurements to align the prosthetic limbs based on the patient's body and the various angles of an anatomical limb. Here are a couple of examples of the alignment phase. The prosthetist will have the patient place their limbs into various positions to assess length and range of motion. Step 6 is delivery. After all of the components of the patient's final prosthetic device have come in, the prosthetist will put them all together and then it's time for the delivery. The delivery is the appointment where the prosthetist fits the final prosthesis to the patient. At this appointment, The prosthetist will educate the patient and also provide them with various opportunities to practice using their new device. Part of the delivery is the fit check. The patient will try on their new device and assess for optimal fit and function. If everything looks good, the patient can take home their new limb. Step 7 is adjustments and follow-up. During the adjustments and follow-up phase, the patient will periodically visit the prosthetist to address questions, concerns, or changes in the prosthesis fit or function.